Hello everyone, this is Chris and Nancy from 27 Degrees Consulting. We've received a lot of questions regarding COVID-19 over the last few months, and we've responded, as many of you know, over the internet in a number of platforms. But we thought it would be nice to put a formal presentation together to talk specifically about where we have been and where we're going and what we should expect as time goes on. What will be the new normal? So without further ado, let's move forward and discuss this.
So as you can see, this next slide is a little busy. I'm going to pull out some highlights as we do a quick recap. Late last year, this whole thing starts, and then in January, we see our first U.S. case reported. By the end of January, the World Health Organization declares a global health emergency, and President Trump enacts the China travel bans. In February, we see our first U.S. death, and as the global death rate soar, the World Health Organization declares the outbreak of pandemic in March. March is also when U.S. bans all travel from European countries and declares a U.S. national emergency. By this time last month, 95% of Americans are under lockdown. Also, this last month, we've seen unemployment rates soar, we've seen stimulus packages come out, we've seen anti-lockdown rallies, and finally, this past week, we have seen some states reopening.
So I now want to talk about one of the most effective measures we have for reducing spread of the virus, and that is social distancing. On this slide, you can see that the number of cases are represented in the vertical axis, while the number of days of infection are noted on the horizontal axis. If we have a large number of cases in a short period of time, it can very easily overwhelm the healthcare system's capacity. The healthcare system's capacity is represented by the horizontal line noted as healthcare system capacity. Without protective measures, there's a sharp peak to the curve which goes beyond the healthcare system's capacity to care for patients with the disease. This means that we overwhelm our hospitals. We do not have effective personal protective equipment. We may not have enough healthcare providers, and we may not have enough ventilators. All measures that are needed to care for patients with COVID-19. If we're able to practice social distancing, we can see how the curve flattens out. And with that, we have enough healthcare resources to care for patients with the condition.
So when we talk about social distancing, I found this was some research done by the state of Kentucky. And it's a great visual to show why social distance is important and does it work? And certainly you can see that it does. We start with no social distancing in place with one person infecting 2.5 people over 5 days. Now, by the end of that 30-day period, those couple of people have infected over 400 people. With measures in place, when you decrease exposure 75% less, you see that same one person infects not even a whole person. You're at 0.625. At the 30-day mark, 2.5 people are infected. So that comparison versus the comparison on top of the 406 people is very impactful.
So what are the effects of social distancing? We've seen that schools have had to shut down, businesses have shut down, religious services have shut down. The effect has been really broad on our society, and this has had a great deal of effect on us as a population. Has it been effective? Absolutely. Is it difficult? Absolutely.
You know, one of the things that we want to say too, on our website, on our Instagram and our Facebook page, we did post some helpful links. So homeschooling, a lot of people were challenged by homeschooling. So there's some links on that for some very useful resources to work with your kids. So as we go on then to the next slide, sector and look at what the challenges specific to healthcare have been. So I think we'll talk first about hospital capacity and the concerns, especially early on. Remember the early on models where they were talking about?
Initially, the early models showed that hospitals would be overwhelmed. And in many instances, they were clearly stretched to the limits. And this has been very stressful for many hospital systems, no doubt. But there's been a lot that's been done that has really helped hospitals out. I think one of the big things that we've all done in helping the hospitals out is, as mentioned before, we've socially distanced, we've worn masks in public, we've really reduced the spread of the disease as best we can, and we've flattened the curve. And this has really helped hospitals out quite a bit. That being said, hospitals have been stretched to the limit in many instances.
You know, there's an interesting flip side to that too, is patients are afraid to go into the ER, so if they're experiencing chest pain at home, they're not going in right away. And I think it's an important message to get out there that yes, please, the ERs are safe. Go in if you need emergent care.
So let me talk a little bit about personal protective equipment, or PPE. You've heard, as we all have, that there's been significant shortages of this type of equipment, which has really stressed out the healthcare field. So why? Why is there such a shortage? Well, a lot of it is just a supply and demand issue. You know, we never expected that we would require as much PPE as we do require, and there just was not enough that was available. Also recall that this pandemic started overseas, and most of the equipment at that time was in China, where the pandemic started, and most of the equipment stayed in China. So this became a real issue. We weren't really making a lot in this country. We make some, but a lot of the stuff was made overseas, and it was hard to really get that equipment as we needed. Hoarding was a big issue. We all know this. I mean, if anyone who has lived through this knows how hard it was, for example, even to find toilet paper or hand gel, hand sanitizer around the time that this all started. People really panicked and hoarded equipment, including protective equipment that really was needed for hospitals. So what are we doing now? Well, we've purchased, of course, what's available. We've amped up production, and we're starting to produce some equipment in the United States. I think the biggest thing that's been important has been resource allocation. There's been really a great move to get the equipment where it needs to be, and that's been really important, prioritizing need, matching the need to whatever the equipment is that's needed. And then, finally, I'm going to talk a little bit just about how does this affect testing, and this has been a really big issue. Testing is limited for a couple of reasons. It has been, at least. It's better now. One of the issues has been the availability of testing, but one of the issues early on was the availability of personal protective equipment. Many of us in the healthcare field couldn't even do the testing that was required because we didn't have the equipment available to protect ourselves during the testing process.
Just kind of backing up and talking about the personal protective equipment, what kind of challenges did you see in your office with that early on?
Well, early on, we didn't have adequate PPE. N95 masks weren't really part of what we would use in a primary care practice. So we really had none, and we had no access to any either. And it became a real issue because we realized in short order that we couldn't protect ourselves. We were seeing patients, many with respiratory complaints, and frankly, it was quite scary to do so. We were very worried about contracting the disease ourselves, and in fact, one doctor in our practice did become sick, and she, fortunately recovered and did well. But, there was just a lack of equipment, and, as it turned out, we realized at one point very early on that we couldn't protect ourselves, and we probably weren't doing what we needed to do to protect those who were coming into the office, and we ultimately had to shut down our office. It was a very difficult decision to make. We had to furlough all of our staff except for bare bones minimum staff. We went down from a staff of 17 to a staff of 4, and we started seeing patients by video visit, which was really the best we could do to keep ourselves and our patients safe.
As we look at the next slide, slide 10, we're going to talk a little bit about risk to the healthcare workers, which unfortunately has been pretty significant. Again, we're looking at availability of PPE early on. It's a little bit of a better situation now. Looking at changing guidelines. I mean, when I worked in the hospital, you'd wear a mask and you'd just throw it away, not even thinking of it. Now we're looking at processes that have been put into place with mask use, that as long as the mask maintains its integrity, you're reusing masks. We're looking at places re-sanitizing masks.
Right.
But there has been an impact to healthcare workers. And there's also been physical and mental impacts noted. So the stats that you're seeing on this slide have been generated by the U.S. Centers for Disease Control. They had done a study, and it was limited to February 12th through April 9th. So as you look at these numbers, you can see, plainly see that they're most likely underestimated numbers. Over 9,000 United States healthcare workers have been diagnosed with COVID-19. 723 were hospitalized, including 184 in the ICU. And then at least 27 had died from the COVID-19 infection. Do you want to add anything?
Yeah, I mean,
to this?
just to add a little bit to that, Nancy. I mean, there are things that we're doing now with masks and with PPE that I never would have imagined 5 months ago that we would be doing. So as Nancy and I do this talk, we're both sitting here in our masks, and the mask that I'm wearing now, I've been wearing intermittently now for 2 weeks. I go to the nursing home 2 times a week, and you know, the nursing home, as I'm sure everyone knows, is a pretty scary place these days. I'm fortunate that the nursing home I go to has not had any COVID cases among the residents, but these are hotbeds of COVID cases, and you know, going into a nursing home is at this point frightening, and we basically wear protective equipment to protect ourselves, but also to protect the residents who are really at great risk of death from this disease. So I never would have thought I'd be wearing the same mask for 2 weeks months ago, but that's what we have. You know, we're wearing them until they are not usable anymore. I want to just also comment on the mental impact to healthcare workers. This is an incredibly stressful time for nurses, for doctors, and for all those that are involved in the healthcare field right now. And we've seen physicians commit suicide. We've seen some really horrible things happen, and people just having a very difficult time being able to deal with the stress that this brings about. So, you know, I just can't overstate the effect that this has had on all of us who are working in the healthcare field. It's been a difficult time. All right, I want to talk a little bit about the financial impact that this pandemic has had. Let me start with hospitals. I mean, one would think that hospitals would do well during this time. In fact, hospitals are really suffering throughout the country. They're losing up to about $1 million a day in some instances. So why is this? It's actually, if you think about it, it all makes sense. All of the elective stuff that hospitals did, where a lot of money is actually made on their balance sheet, it's what helps them to stay in business, all that stuff is gone. So there's no elective surgeries, for example, being done. Many hospitals are actually not that busy because people are afraid to go into the hospital. So they don't go in for things that they should be there for. So that reduces the census and thus the amount of income that the hospitals bring in. A lot of emergency rooms are not as busy as one may think. In fact, some hospitals have had to furlough staff for this reason. Now, this is not every hospital. There are other hospitals that are busting at the seams because they're in a COVID hotspot and they're really stretched to the limit. But even those hospitals have some financial stress because of the cost of caring for these very, very sick patients. Other issues to think about in regards to the financial impact of this: unemployment rates throughout the U.S. Unemployment rates have been soaring, of course. We all know that. We all know someone who has been furloughed or laid off during this pandemic, and the rate is higher than it's been in my lifetime. And talking about just, practices, medical practices, many have closed down. They've had to close down because they can't safely see patients. And if they haven't closed down, their volume has decreased significantly. So the impact financially has been really dramatic.
Chris, can I ask you a question? Just with
Sure.
practices, so a lot of practices we've seen have moved towards like a telehealth model.
Yes.
Can you talk a little bit? The reimbursement for that is the same, and is that going to continue?
Yeah, so one of the good things that the government did was they made it so that we could do telehealth visits, because frankly, it's the only way we can really care for many patients right now, with our offices in many instances being closed. So, before this pandemic, there was spotty reimbursement for telehealth, and it wasn't really embraced by many. I think it was done in more rural areas where there weren't other options. But certainly, if someone could come into an office, we weren't doing telehealth. It was really the utility or how much we used it was minimal. Now it's all of what I do, other than when I'm at the nursing home. So all of my outpatient practice is telehealth. The reimbursement, it seems, is equal to what we would get in seeing the patient in person. Of course, the type of visits we do are really limited, right? So we can't do physicals, we can't do wellness visits, those things that we did previously. We're doing a lot of follow-up of chronic care, which is very important, and sick visits. So it's what we have right now. I think it's great that the government has changed the regulation in relation to that. Otherwise, we wouldn't be able to be reimbursed for the care that we're providing right now. And it's really kind of keeping us going from a financial perspective.
So we're looking at organizational change across the board: nursing homes, hospitals, physician offices. We're seeing people working from home. We're seeing workforce reductions. We're seeing visiting restrictions, pretty severe visiting restrictions. And we're also seeing service line interruptions. So as we're dealing with all this, the question becomes really, how are we meeting the needs of our patients? And we post this question out on our social media sites, and we've gotten some great responses back when we look at some of the innovative ideas. Some people have talked about what they're doing in the nursing home. So Chris, you can
I can talk
share
a bit
some of
about
those.
what we're doing in that sector. So, when this all came forward and broke, the first thing we wanted to do was to keep our residents safe. And we had to make some really difficult choices. This is the norm now, but 2 months ago it wasn't the norm. The first thing we did was we closed down the home. We closed it down to visitors. And this was really difficult. And we have, in my particular home, 280 some odd elderly patients who, have many of whom have very close relationships with their families and are used to being visited, if not weekly, sometimes on a daily basis. And we shut that down. We had to, because it was very clear, even from the beginning of this whole pandemic, that one, the elderly in nursing homes were clearly at significant risk, and the virus was not starting de novo in the homes; it was being brought in from outside. So as soon as we were able to, we shut down the home. We also really jumped on the PPE bandwagon early. We were fortunate that in our home we did have available some personal protective equipment. So initially we began with all staff wearing masks. And now we've moved on to masks and face shields. We stopped all of the typical gatherings that would occur in a nursing home. So we have, for example, a church in our nursing home. There were no more masses. As far as activities, there were no more group activities. And we've been able so far, with that, and I think also with some luck, to keep our residents safe. But there's an impact that all of this has. The residents have, in many instances, been very lonely. So, what have we done about that? We've had tried to have a lot of interaction with family members through Facebook, and we've had drive-by kind of window sighting type visits, that type of thing. And we really try to set that up for residents as much as we can, just so they can get through this from an emotional perspective.
I think just adding to the innovative ideas, we've seen a couple of great ideas come out. one from a nursing home, a couple from hospitals that people have shared with us. One idea with the nursing home was they would actually see who the representative of the family was, that next of kin. They would take a picture of the family member with the family member's phone number, have that sheet laminated in the patient's room. So anytime anyone went into the room, anytime any healthcare worker went into the room, if they had a discussion with that patient, they would call the family member up right away and do a shared discussion. You know, we've seen in hospitals at critical moments that nurses have been using FaceTime to connect patients with their families. We've seen one of my friends, her mom fell and broke her hip and had to have surgery done, and then had to have some rehab at a nursing home. And her daughter is a nurse and is a very strong advocate for her mother. And it was very, very difficult not to be with her mom, who was in her 90s, through all that. But one thing that the rehab center did was they had a room in the back of the facility where the families could come around in the backyard, and they had a big pane window, and they would bring the patients in one by one to have that family time through the window glass. You know, so at least there's some type of connection there. There's been some great innovative ideas, and we'd like to hear more ideas from you so we can share those, so other people in other facilities can start implementing and instituting those.
Yeah, the other thing I'll just mention about nursing homes, and I'm not sure how innovative this is, but it's certainly something we didn't do 3-4 months ago. We talked about it, but we never did it. Just another thing to do to keep our residents safe. We're seeing across the country that more and more physicians are doing video visits in nursing homes, physicians and nurse practitioners. And this becomes important because it's very clear that other people bring the disease in, and many of us, physicians and nurse practitioners, PAs, those who practice in nursing homes, really go to more than one nursing home. So there becomes the concern about us bringing the disease in from one facility that has it to another that doesn't. So we see more and more video visits being done, telehealth visits, and that's, I think, another way we've been innovative in order to keep our residents safe.
So again, I think it's important where we're doing so much isolation that we concentrate on the human experience and really bring that to the forefront. We've talked about some innovative ideas that some of the facilities are using, but how are we feeling and how are we connecting spiritually, socially, physically with other people when we have to have that social distance in place? One of the stories that I'll share with you is an RN who wrote in, and we posted this story actually on our Facebook site. So I'll read you her story and some of what she had been feeling. I had my babies go stay with their dad, and I can't see them face to face for who knows how long, but at least I will get to see them again. So the constant feeling of dirtiness and your skin crawling, the 3 a.m. phone calls to families explaining that they did not take their last breath alone, the loneliness and worry, the longing to just hold my babies and never let go. It's worth it. If I can help so many feel an ounce of peace, I'm an RN. Many don't understand all that exists behind those initials. What we carry with us on a daily basis. I'll do it every single time. Always. I'll choose to take lead and be front line because of who needs us. I think that sentiment underscores so much of what everyone has been doing during this pandemic.
Absolutely.
And beautiful stories like that, we would love for you to share those with us so we can post them and just be inspiring to other people as well. So these numbers are certainly chilling, and we know that people are still getting sick. So then what does that mean? I think it's important at this point now to really talk again about the symptoms of COVID-19 and when you should be concerned. And Chris will take it away.
Yeah, I think most of us know this, but it's definitely worth a review. Here are the things that the Centers for Disease Control notes as symptoms that we commonly see. And you'll hear about a few other symptoms here and there if you do research on the internet, but these are certainly the main ones and the ones that the CDC talks about. So fever is very common with this disease. It can be quite high, it can be low grade, it depends. Chills, and these can be also what we call rigors, which are repeated shaking, really vigorous chills. Shortness of breath is very common, and the thing to know about this is if it is extreme, you really need to be immediately evaluated by a physician in an emergency room setting. Cough is one of the hallmark symptoms. Muscle pain, almost like when you have the flu. If you've ever had influenza, you know this symptom. It's just achy everywhere. I'm not really talking about, my thigh hurts or I got a little pain in my bicep. We're talking more about generalized muscle pain. Many patients have headaches, and they've been described to me by patients as being quite severe. They can be throughout the entire head, throbbing, vice-like. They're described a number of different ways. Sore throat is very common. And as you can see, these symptoms can be symptoms of influenza or other viral illnesses, and that's what really makes this tough. Right? These aren't specific only to COVID-19. The one thing that I think is very specific that I see is the loss of sense of taste and smell or smell. And you don't see that with a lot of things. I'll occasionally see it with a patient who has really bad sinus disease, sinusitis. But in general, this is a really specific symptom to this condition.
So let's talk a little bit more about testing now. We've touched on this just a little bit, but we'll go into a little bit of a deeper dive. There's two types of testing: diagnostic or viral testing, and then there's antibody testing or serology testing. Now, diagnostic testing, that's going to tell you, do I have COVID-19 or not? With your antibody testing, that's going to be, have I had COVID-19 or not? Where can you get testing done? What's that like? How do you sign up for it? Chris went over all the symptoms that a person would have. If you think you have those types of symptoms, you're contacting your PCP. He's giving you a referral, and then you're calling a testing site to schedule an appointment. So where are these testing sites? The easiest thing to do is look at your state website, so mass.gov, rhodeisland.gov. They'll have a list of testing sites. So talking to the Massachusetts testing sites, CVS has a couple of testing sites, and I think I've read in the news too that CVS is coming out with 1,000 more sites nationally soon. But basically, we're looking at hospitals, physician offices, urgent care centers, and most recently for the private testing that can be done in the private labs, and that cost is probably between $75 and $125 is what I'm seeing in the private labs. So again, very important to be aware that you can't just drive up and get tested. You have to have a physician referral. The sites will do their own screening. You're looking most likely at a nasal swab being done for the test, and they do have some point of care testing that's done within 10 minutes, but more than likely you're looking at 2 to 3 days to have your results come in. Is that what you've seen too?
Yeah, let me just tell you a little bit about what happens in my practice. So if someone calls me and they have a concern and they seem to meet the criteria for testing, I call down to the testing center, which is in our medical practice. It's an outdoor testing center. Basically, the patient drives up, and without getting out of their car, they have a nasal swab performed, and then I get the results in about 3 days. One thing to understand about both of these tests, the diagnostic viral test, which tells you if you are currently infected, and the antibody serology, which tells you if you had the disease. One thing to understand is these are not perfect tests. Let me start with the viral diagnostic test. The false negative rate is 30%. What does that mean? That means that 30% of the time, you're going to get a negative test and you're going to have the disease. That's a pretty scary number. And I think this is a useful test if it's positive. It may be useful if it's negative, but I think it can also be very falsely reassuring if it's negative. So what you don't want to do with this information is have all of the symptoms, have classic symptoms, get tested, have it be negative, and then feel you don't need to do anything further as far as quarantining. So I tell patients all the time, if they've been exposed and they have classic symptoms, regardless of what the test comes back, they're going to quarantine because they're going to be basically exposing others. if they have that falsely negative test, and now they feel reassured and do what they should not do.
So the next thing we'll talk about is staying safe, and we've covered a lot of information up to this point, but how are we staying safe moving forward? We've seen now that a lot of states are under the mandates to wear face masks out in public, so that can be our starting point in talking about ways we can stay safe. We'll talk a little bit about face masks and the differences between a few face masks. We'll look at the N95s versus surgical masks versus these wonderful homemade masks that people have been doing a great job making for us. So Chris, you want to start talking about the masks?
I'm a firm proponent of face masks. Masks absolutely save lives. So it is something we should all embrace. And they all work to some degree, some more than others. So if you are a healthcare provider and you're working in a hospital or a nursing home where you're exposed to COVID patients, potential COVID patients, you should be wearing an N95 mask if they're known COVID patients, certainly, or suspected. This is the mask that's going to protect you the most. After that, we have surgical masks. Surgical masks do provide some protection, but what they also do, and all these masks do this, is they prevent the spread of COVID to others. So it is particularly important that we wear a mask at all times when in a public type situation, because regardless of what the type of mask is, it's going to reduce the spread of the disease. The homemade cloth masks, they do that, they help. So when you're out in public, wear what you got. If you got a surgical mask, wear that. If you got a cloth mask, wear that. You probably don't have N95s, and honestly, if you got a stockpile of those, bring them over to your local hospital because they could probably use them. You don't really need an N95 out in public. The N95s are more for those who are doing direct care with COVID patients or COVID suspected patients.
I'll just say a couple of comments on wearing a mask too. Be careful that you're washing your hands a lot. When you take off your mask, if you're touching the front of your mask when you've been around people or haven't been able to maintain that 6-foot distancing, realize that your hands are now contaminated with any contaminants that have gotten on the front of your mask. You should be taking your mask off, your homemade mask or the surgical mask or the N95s off by the elastics. You can store the masks in paper bags. I wouldn't store them in like plastic Ziplocs or anything. That's more of an environment for bacteria to grow. The paper bags are what's recommended, or even the surgical masks or some of the homemade masks, you can use envelopes. Like a regular envelope is fine to hold some of the masks and keep them.
Yeah, and of course the homemade ones can be washed too. You can't do that with the N95s and the surgical mask, but yeah, good points. I see a lot of people touching the front of their mask. You've now contaminated your hand. If you take the mask off and you put it down on a surface, you've contaminated that surface. You have to keep these things in mind. So it's really crucial to know how to put a mask on, how to take it off, and how to care for it.
You know what's been kind of weird too? A lot of people I've seen wear masks and they put the mask under their nose.
Yeah, so that doesn't really help. So
you need to cover your nose and your mouth when you're wearing the mask.
Yeah, so you have to have it over your nose and mouth, and worse, if you have it on the top of your head, it really does nothing. I've seen a few of those around too, but definitely if you have to have the mask covering your nose and your mouth for it to be effective.
So this is a great slide. Sometimes it's hard to fight an invisible enemy. This is a real great visual on what happens when someone sneezes. And as you play this slide, look at that. There's a projection when someone sneezes. This is why we're wearing masks. Those particles, if they get into your respiratory system, if they get on your hands and you're rubbing your eyes or whatever, you've been contaminated. A sneeze spreads at least 6 feet.
Yeah, sneezes and coughs, they spread germs and viruses, bacteria, etc. But it's not only just sneezing and coughing, it's talking too and breathing. And so that's why you have to wear the mask all the time. All of this will spread the virus. So we talked about masks. That's certainly one way that we can all reduce the spread of the disease and stay safe. What's the other thing we can do? The other thing is just limiting social interaction, and in that, staying safe at home is a key part of that. So what does this mean? This means that we really want to limit activity outside of the home. Look at your home as a COVID-free zone. Every time you go outside of the home, there's the potential of bringing COVID in. So you want to limit the activity outside of the home. You want to limit your interaction with other people, as hard as this may be. When you are around other people, once again, wear a mask. You have to be really, you have to do that all the time. You can't let your guard down. Look at your inside world as a clean environment, a COVID-free zone. Look at the outside world as a potential COVID-positive zone. And then have a plan. What do you do when you come home from outside where this infection potentially is? Wash your hands before you come into the home. Consider changing or washing your clothes, or even just putting them in the dryer. The heat will kill the virus. Disinfect common surfaces, doorknobs, countertops, things that people touched without thinking multiple times per day.
I'm going to jump in here too and just talk a little bit about specific plans. So probably some different rules if you're coming home from working in an ER versus if you're coming home from just going grocery shopping at Stop and Shop. So I'll give you an example. My husband's an ER nurse. When he comes home, he puts his clothes in the washer right away. He doesn't go anywhere else except to the laundry room. He washes his hands, and then he'll, just take a shower and change into a new set of clothes. If I'm running down the street to Walgreens and I'm coming back home, no, I'm not gonna wash my clothes right away. I am washing my hands, however. There's been a great article released by the New York Times that we posted on our website, and it had some very specific questions from people and some great answers, I thought. So I'll share some of those questions with you. One was what we just discussed. Should I wash my clothes and shower when I come home from the grocery store? Again, different scenarios in place for that. You're always washing your hands, and actually, and you probably do this too.
Yep.
I keep hand washing sanitizer, hand gel, hand sanitizer in the car, and as we go in and out of stores or as we're handling things, we just wash our hands continually when we're on the road. Second, what about packages? A lot of people get packages from Amazon that you going to grab your mail. What are we doing with these packages? The virus probably does not live on these packages for a very long time. It's most likely safe. There was a study put out by the New England Journal of Medicine that said if you're really worried about things, let them sit for 24 hours. The virus will automatically
they're not going to live on
die.
cardboard or paper more than 48 hours. So if you were to do that, you'd be fine.
And then a common question I get from some of my patients too, especially just kind of tapping back into the face mask slide, is when I go outdoors and if I'm just walking around the block, do I need to wear a face mask? And it really depends on how many people you're coming into contact with. If your street's totally isolated and you can walk up and down and not see another person, then no, you don't have to wear a face mask. Yeah. But if you're going past a construction site, or if you're walking in an area, coming up on an intersection where there's a lot of people around, you should be wearing a face mask.
I think you have to know your environment. I mean, so I live in an area that's fairly rural, so, I walk my dog multiple times per day, and, when I go out, I don't wear a mask, but I never see anyone. And if I do, I can stay safely away from them. But if you're in a more urban area, then, I think you have to wear a mask because you're going to come upon people and you're going to be exposed potentially.
So I should say, any other questions that you have on this, please just send it along to us on our Facebook site, our Instagram site, and I'll get right back to you.
I will say I do like the what your husband is doing coming back from the ER. I do a similar thing when I come back from the nursing home. Sanitize my hands before I touch the doorknob. Change my clothes as soon as I'm in, shower, and change to a fresh pair of clothes. And, it's similar to what he does, and I do that because, I'm in an area where there's potentially COVID-19, and he's in an area where he's exposed to COVID-19. I don't think you need to do that if you go to the supermarket necessarily, but you do have to do good hand washing, definitely.
All the time.
Yeah.
Another thing too, people are going a little crazy because they can't find a Lysol spray bottle to disinfect their house and their doorknobs and their countertops. It's okay to use hot soapy water. It's okay to wash your hands. Hot soapy water is the best thing to use over hand sanitizer.
Yeah, well, we did a whole thing on this. One of our, my little, things we put on the
videos, the
yeah,
info
little
videos.
videos. The word I was thinking of, soap versus these alcohol hand gels.
Yes, yeah.
And I think that in many ways, soap and water is superior. You have to do it, however, the right way. You have to do it for 20 seconds. And why is it superior? Because the alcohol-based hand gels, first of all, do not kill all bacteria. There are some bacteria that are not killed. So we're not just trying to deal with COVID, we're trying to deal with other stuff too, right? And soap and water, it can be actually more effective. And soap and water also takes off debris and grime and that. And with alcohol-based hand gels, it doesn't. It continues to build up. So, you can't always have access to soap and water. I think if you're going out to the market or whatever, it's great to have some of this alcohol-based hand gel around. But if you're home, just use soap and water and save the hand gel for when you're out.
So this next slide really speaks to how are we coping with stress during this pandemic? What kind of things are we doing? And while you're getting many helpful tips from these pamphlets put out by the World Health Organization, what I like about this, it's not only tips for adults, but it is tips for kids too, because of course they're feeling the stress, being isolated from their friends and not really having the same type of grasp we might have of the situation. How do you talk to kids about this and what's going on and how come all these people are dying? So very useful tips on this slide. And I'll also point you back to the state website, mass.gov, rhodeisland.gov, whatever your state is, because they will all list links for mental health resources. So if you are in need, you need to reach out and contact someone. They have great links. Most of them are free.
Yeah, I think this is really important. I mean, we see a lot of patients in our practice. I get a lot of calls with people who have baseline anxiety or depression, who are really suffering and having problems with all of this. So it's important that you know the resources that are available so that you can get the help that you may need.
Another thing I want to give you a little teaser for, we're going to be doing a podcast and we're going to have a therapist on with us to give us some helpful hints and talk about strategies to use during the pandemic to lower our stress.
That's great. Yeah, I think that's really helpful.
So we've seen this hashtag a lot, Alone Together, and we've had some great technology available to us to get us through this. We've seen the use of Zoom explode. You and I have both been in a lot of meetings with Zoom. We've seen game nights on Zoom that we can connect with our family virtually no matter where they are. A lot of great and fun videos coming out on TikTok and a lot of just innovative ways of staying close, maintaining that relationship, staying connected. Again, if you're doing anything that's really fun and innovative and that other people can tap into, please let us know. Post to us on our websites. So, reopening projections, this is where we're at right now. Some states already have reopened. For us in Mass and Rhode Island, we're looking at May 18th. Right now, again, today's May 8th. May 18th has been kind of vetted out there for a soft reopening, maybe on some businesses. It looks like we're going to have a phasing of reopenings with decreased capacity and looking at really ways to reopen the economy, but doing it in a safe manner.
So as we reopen, it's very clear that, one, this is going to be a gradual process. And, society is going to be very different than it was before. We're not going to just flick a switch and be back to where we were. And we don't know when we'll be back to where we were. So what are some of the things that we're going to do to reopen in a smarter fashion? Telehealth. We talked a little bit about this. This is something that we've been doing in my practice and most medical practices have been doing. We're really cognizant of the fact that as we open the doors to our medical practices again, it's not going to be as it was last year before COVID-19 was an issue. I don't think that patients are going to all want to come into the office, nor will we be able to handle seeing all patients in the office. It's going to be a really strict process for screening patients before they come into an office. They're going to be screened by phone before the appointment is made or while the appointment is being confirmed, actually. And then once they come in, before they enter the office, they're going to be screened again. So, that being the case, this is a process that takes a bit of time, and you're not going to be able to see the patients that we're seeing before, as far as numbers is concerned. So we're going to rely on telehealth for a while. We're going to do a really more of a hybrid type practice for us, and for many medical practices, time goes on. We'll be in the office seeing patients and then doing telehealth visits in between visits. I think, in the non-medical aspect of things, we're going to have a lot more virtual meetings. I think the days where 10 people sit in a room and comfortably talk about issues are probably gone for a while. No one really wants to do that now. So Nancy talked about Zoom. Zoom's a great platform. There are other platforms out there too, but there's going to be a lot more virtual meetings. And the truth is, you can get mostly everything done in a virtual meeting that you would.
I think that's probably one of the positive things that came out of this, really utilizing more of the virtual meeting platform.
Right.
Because it's just a time saver.
Well, you know what? I think this is a good point let's try to look at any positives that are out there. I think this has been devastating to our society. I don't want to minimize that in any way, but what I was talking to some of my colleagues about the other day is how it has forced us to be innovative and to do things that we never would have done before. So, like I said, telehealth was out there. It was underutilized. Virtual meetings have been around for a while, but they were underutilized. So these are things that we'll be using more of now that we probably would not have used if it weren't for this situation that we're in.
I agree. And just with the relationship building, accessing, for the first time, I've accessed a lot of different things that I haven't used some technology before. So having accessibility to that and using that has been great for maintaining some of my relationships.
Absolutely.
What we'd like to do is for you, again, to send in how you're going to be reopening smarter. If you're a small business, if you're in healthcare, what are the ER waiting rooms going to look like? How are you going to be managing your waiting rooms? We'd love to. So our last slide is really this: what's next? What are we looking to? What are the next steps along the pandemic timeline? I think the biggest concentration now is vaccine development. Usually it takes 5 years to develop a vaccine. We're on an 18-month timeline, so that's astounding in itself. And we're hearing reports that maybe by early next year we'll have a vaccine that's made it successfully through the trials. And listening to Dr. Fauci speak, he's looking at 2 very promising vaccines that are in development currently. Along with the vaccine development, we're looking at widespread testing capability, we're looking at phased reopenings, and we're looking at preparation for a possible resurgence in the fall, early winter.
Hopefully not, but it seems like that's possible. And it's for that reason, even as we reopen, we have to still be cautious in relation to protecting others and doing what we need to do not to spread the virus.
So I guess when we look at overall the takeaways from this, the main messages here are continue to stay safe, continue moving forward in a smart, innovative way, look at what we've had to adopt and how we've had to be flexible and utilize those things moving forward as we recreate our processes for our new normal.
Correct.
What else would you say?
No, I think you hit the nail on the head. I think that the world's going to be very different, there's no doubt, as we move forward. But it doesn't mean that long term it's going to be worse. I think that there is a lot that we have learned dealing with this pandemic. There's a lot of wisdom that we will carry with us as a human race as we go forward, as Americans as we go forward. And I'm hoping that 1 year from now, maybe less, as we look back on this, we'll be a better country and better people, and we will have survived this and gotten through it, and we'll be moving in a much more positive direction.
And as always, through it, please tap into our social media sites, our Facebook, our Instagram, our YouTube channels. We'll keep you updated with the most recent developments as we work through this, like Chris said, together.
Some final thoughts. In conclusion, as we move forward, it is important to take our lessons learned and apply them to our new normal. We need to employ innovative new strategies and use the technological advances we have achieved to succeed in this pandemic. We need to support one another as a society and a community. I believe that in doing so, we will succeed and ultimately return to a more normal way of life, with COVID-19 a memory rather than a daily reality. Thank you for watching our presentation, and I do hope that it was helpful.